Triamterene, also known as Dyrenium, is a diuretic medication that works in your kidneys to increase the amount of urine you make. This helps your body get rid of extra water and decrease swelling, edema, caused by conditions such as cancer, heart failure, liver disease, and kidney disease. It can also help your kidneys work better and lessen symptoms such as trouble breathing and swelling in your ankles, feet, hands, or belly. The usual dosage of Dyrenium is once or twice daily, and it is best to take it at the same time each day. It is important to follow your doctor's instructions for the correct dosage and timing of this medication. When taking Dyrenium, it's important to follow your doctor's instructions. Usually, it's taken once or twice a day after a meal. If you take it too close to bedtime, you may need to wake up to urinate, so it's best to take it at least 4 hours before bedtime. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. The dosage will be based on your medical condition and how you respond to the treatment. Take Dyrenium regularly at the same time each day to get the most benefit from it. Don't increase your dose or take it more often than prescribed, as it won't improve your condition any faster and may increase the risk of side effects. It's important not to stop taking Dyrenium without consulting your doctor, as some conditions may worsen if the drug is suddenly stopped. Your doctor may need to gradually decrease your dose. If you don't feel better or if you get worse, be sure to inform your doctor. Some common side effects of Dyrenium may include dizziness, lightheadedness, tiredness, headache, stomach upset, or diarrhea. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, Dyrenium can cause dehydration and electrolyte imbalance. It's important to tell your doctor right away if you experience symptoms of dehydration or electrolyte imbalance, such as confusion, unusual dry mouth/thirst, fast/irregular heartbeat, severe dizziness/lightheadedness, or seizures. Some serious side effects to watch out for include nausea/vomiting that doesn't stop, stomach/abdominal pain, yellowing of the eyes/skin, dark urine, signs of infection, signs of kidney problems, joint pain, or easy bruising/bleeding. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you experience any side effects, you should also report them to the appropriate medical authorities in your country. Taking Dyrenium can potentially raise your potassium levels, which is especially important for those with kidney disease, diabetes, or severe illness. It is crucial to monitor your potassium levels while on this medication, as very high levels can be dangerous. If you experience muscle weakness or a slow or irregular heartbeat, it's important to seek medical attention immediately. The daily dosage and optimal timing for taking Dyrenium will be determined by your healthcare provider, so be sure to follow their instructions carefully. Before taking Dyrenium, it's important to discuss your medical history with your doctor, especially if you have kidney problems, liver disease, mineral imbalances, dehydration, gout, or conditions causing low folic acid blood levels. This medication may cause dizziness, so it's important to avoid alcohol or marijuana, which can make this symptom worse. It's also important to avoid activities that require alertness until you know how this medication affects you. If you have diabetes, Dyrenium may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and discuss any changes with your doctor. Severe sweating, diarrhea, or vomiting can increase the risk for dehydration, so it's important to stay well hydrated unless directed otherwise by your doctor. This medication may also increase your potassium levels, so it's important to consult your doctor before taking potassium supplements or salt substitutes that contain potassium. Dyrenium may also make you more sensitive to the sun, so it's important to limit your time in the sun, use sunscreen, and wear protective clothing when outdoors. Before having surgery, it's important to inform your doctor about all the medications and products you are using. For older adults, it's important to be aware that they may be more sensitive to the side effects of this drug, especially high potassium blood levels. During pregnancy, Dyrenium should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with Dyrenium, as they can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, and always seek their approval before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Dyrenium include those that can increase the level of potassium in the blood, such as amiloride, cyclosporin, eplerenone, tacrolimus, and birth control pills containing drospirenone, as well as lithium. Additionally, there are products with ingredients that could raise your blood pressure or worsen your swelling. Make sure to inform your pharmacist about all the products you are using, and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. It's also important to note that Dyrenium may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using this medication. If someone has taken too much Dyrenium and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include severe dizziness, muscle weakness, and a slow or irregular heartbeat. It's crucial to get medical attention right away in these situations. It's important not to share Dyrenium with others. Your doctor may also order lab tests to monitor your potassium levels and kidney/liver function while you're taking this medication. Be sure to keep all your medical and lab appointments. If you forget to take a dose of Dyrenium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. It's important to store Dyrenium at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush it down the toilet or pour it into a drain unless specifically instructed. Properly discard this medication when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.